10, 9. Well, good evening, everyone, and welcome to a beautiful February day, the fifth meeting of the 144th Council of the Corporation of the City of St. Thomas. Are there any disclosures of interest from any of the members? Seeing none, we'll go to minutes.
I have a motion that the minutes of the meetings held on January the 15th and 17th, 2024 be confirmed. Moved by Councillor Herbert, seconded by Councillor Peters. Thank you.
Questions or comments? Seeing none, all those in favor? Any opposed? That's carried.
Our next order of business are presentations. The presentation this evening is a certificate of recognition. The mayor will present a certificate of recognition to David Warden. On behalf of the council and the corporation of the City of St. Thomas, it is council's pleasure to recognize David Warden, honoring his many years of service to the St. Thomas Police Services Board, advocating for our local community safety and wellness, as well as having served on many essential committees, boards, and council that have been responsive to community well-being. We are also celebrating the legacy of hard work and commitment that Mr. Warden leaves behind.
What kind of sandwich? Great. David, you and I see each other at least once a week, if not more, with the different boards and such that you served on. But what I don't get to do is get up early anymore and see you at police services. So this is a recognition of your, I want to say 19 years on different police services board. Is that correct?
That's correct.
So you started when you were only 4.
Well, I wish.
All right, I lied. But I really want to congratulate you for this. There's we know that you sat in one of these chairs at one time too, but you didn't stop serving as people of St. Thomas and Elgin after that, kept going on and serving on the police service board. And now I certainly serve with you on the health board. So congratulations. So here's a certificate saying all the nice things that you've done.
Thank you.
And we'll take a picture with that. Yep. And in recognition, one of our Civic Award pins for your time, efforts, and all of the good work you've done with us.
Your worship, it's been an honor and privilege to serve the city of St. Thomas.
Well, and as long as you want to keep doing it, keep doing it. Chief, thank you. Great. I'd like to also share with the folks at home and those streaming with us or on Rogers. You will see that Councillor Baldwin Sands is here on Zoom tonight. So just 2 dimensions of Councillor Baldwin Sands tonight, not 3.
Your worship, going to the next order of business under deputations, we have the Central Community Health Center folks with us relating to the opioid use disorder. We have Dr. Mai and Laura Moon to provide a verbal presentation regarding the initiatives undertaken by the center to address opioid use disorder. If you can just come up to the microphone.
Perfect.
Good evening, Mayor Preston, city councillors, ladies and gentlemen. A few other people who came to boost me up. Paul Jenkins, our vice chair, and I see Chris Harridge up there, who's also been on our board for quite some time, and we miss him. So I just wanted to introduce, I'm Laura Moon. I'm the Director of Primary Care at Central Community Health Center, and I moved from beautiful Parry Sound to come here to do this job. And in 2015, I've loved every minute. The center is healthcare with a difference. We're not just a whole conglomeration of physicians and nurse practitioners taking care of primary care. We're that and so much more. We have teams working with mental health and addiction. one of whom you'll meet very shortly. We have a team that works with chronic disease management, so all of our folks with diabetes and COPD. We also have a team working with what we call our walking well and our young families. So all of our little ones, even Dr. Nadir, who says he's going to work till the day he dies. We'll see. I wouldn't be surprised. So we have that pediatric knowledge, and we're just so fortunate to have all of those. But on top of that, we have physiotherapy free for people who can't afford this. We have counseling with our social work team. We also have a dietitian who helps not only in the center with our clients, but she also helps out and about with different food security and nutrition initiatives all around Elgin County. So we're very fortunate to have it. We're very crammed. I was told to put that in there. As you all are aware, we've been looking for a building for such a long time. But this program that we're talking about tonight is around opioid use disorder and how we can actually start making a real difference. And I think as you hear what Dr. Mai has to share with you, you're going to realize that this is one of the true hopeful things that we've been working towards for a while. Dr. Mai.
Thanks, Laura. Mayor, councilors, thank you so much for having me here tonight. I don't have much time, so I'll get right to it. So I'm here tonight to talk to you a little bit about what we've been doing, to give you some background about our program. First of all, I'm a family physician. I've been here for about 20 years. I had a private practice for 17 years by the mall, and the last 3 years I've been at the CHC, and we've done kind of some programs that have kind of changed how opioids are being treated. I want to share that with you. So yeah, first thing, give you some background about the opioid issue, how we're dealing with it, talk a little bit about future concerns that I have, and then maybe ask for a little bit of assistance from the city. So first thing is, as we all know, opioid use disorder has been a growing problem across the world, especially in North America. You know, death rates have doubled in the last few years, and it's an epidemic. And so we have seen different things being done and tried, and you know, governments are desperate to try to make a change, make it better. Money has been given to different programs, and some have been somewhat helpful, others have not. When I started here 3 years ago, you know, I had a bit of background in addiction medicine. I did some training at CAMH, and I started a program back at my clinic, and I found it to be quite successful. Just kind of by trial and error, I found that using a medication called Suboxone, which is now the first line therapy for addiction, is quite effective for treating people who have opioid use disorder. I mean, that's why it's the number one recommended medication. The problem is that how do we get people to buy in and accept the medication? Because it is a long-term commitment. It requires a bit of understanding. It requires some skill from the clinician to have people understand what their long-term goals are so that they'll buy in. When people get on the medication, almost always they feel a lot better and want to continue. So what we decided, or how things started, was Shelley West, my nurse, had already been working at the outreach clinics in St. Thomas, working with the vulnerable patients. So when I came in, my interest was very much to do addiction medicine, kind of specialized in that, rather than just doing the general medicine that I was doing before. So we started working with these clients, and you know, my goal was to get them on this medication to help them deal with their withdrawal, which is the most difficult thing for patients or people with addictions to manage, right? They get the high initially, but the high is not what they chase after a very short period of time. It's the withdrawal that they're trying to avoid because it feels horrible. So it's an up and down. And so this medication works great for the withdrawal. So I was trying to convince people, you know, if you take this, you won't have these horrible withdrawals. You'll get more, you know, function. You'll be clear-headed. Anyway, long story short, people were not interested initially. But I knew that it would work because I had done it for the past 3 years in my own practice, where my patients knew me, they trusted me, and they did it, because there are plenty of people who are still functioning, working in your private practices, who have opioid addiction. And those people were my test subjects, because they trusted me. We tried it and it worked. So I got here thinking, okay, well, I can do the same thing, deal with this vulnerable population the same way, and we're done. But unfortunately, people are very resistant to it. They don't know you, they don't trust you. There's a lot of myths out there about this medication and how, it doesn't deal with pain and all this other stuff. And so it took a little while for us to get some people on board, some key clients who were vulnerable patients, and it worked really well, as I expected. Then they were able to spread the news and we were able to get more and more people on this medication. And luckily, at the time I started, this medication became available in an injectable form too. So when I started at CHC, I mean, so the injectable form lasts 30 minutes, that's 30 days, sorry, and people do not have to come do urine tests. They don't have to take medications every day. So it works really well. And once they get on it, they don't have withdrawals anymore. Their cravings for opioids go down and they have more function. So the key was to try to get people interested in doing this. And I had some success after people were spreading the news. But then it dawned on me that people still wanted to use other opioids. And that is what the science shows. Even if you are on treatment, people still crave and use. And they were using illicit drugs, and there's lots of issues with that, with all the different things in there. And so in kind of an aha moment, I said, you know what? Let's see what would happen if I offer people a small amount of opioids if they agree to take the shot. And this was fortunate because if you have the shot, it's in your fat and it stays there for 30 days. There's no way to get it out. So I said to them, if you can commit to the shot, I will give you a daily dosing of hydromorphone or Percocet in small doses. And lo and behold, people said yes. And even though the opioids they were taking don't really make much of a difference, it's more of a psychological dependency that people need to break. So anyway, that allowed the program to expand a lot more. And so then we were watching and seeing, so are we doing the right thing? Are people getting better? Or, having these opioids, is it making things worse? And we found anecdotally that it has really helped people come back saying that, yeah, we feel so much better. And that is where we want to judge our success on function. And we have seen improved function in terms of getting back to work, getting off ODSP, getting their children back, less trouble with the law, less emergency visits. The very positive thing that I can say is that every patient who's on my program who has this injectable, they have not overdosed once. So there are patients of mine who used to have 3 overdoses every week and they haven't had any for 3 years. So that is a real win. But for me, it's more than that. And I want, the concern I have going forward is that I hope our city continues to understand addiction for what it is and not adopt the safer supply program that some other cities have done, because I can see great harm. Even though it does help some people, I see in general as a community, it does great harm. And it draws people away from real treatment like this. So I see, because I have colleagues who offer this treatment in London, but they can't get people to come because if they have the choice, people would take the short-term, quick approach to dealing with their problems by getting prescription opioids from a clinic. And addicts being what they are, the program has inherent flaws that they exploit. And unfortunately, that has led to increased numbers of opioids on the street and more problems than initially was anticipated. So that's my warning. I implore you to not consider moving forward with any kind of safer supply. And then the other part is we want to prove clearly, objectively, that what we are doing is working. We know anecdotally that we are doing a good job. We want to do some research so that we can prove to anyone who wants to bring safer supply here or elsewhere that maybe there's a different way that works a lot better. And so that is my ask for assistance. I am very busy with the clinic. We have more and more people every day, and I'm happy to take them on and treat them, but I don't have time to do the research, the good research that's necessary. So we've talked to different agencies. Our partners have been trying to look for some funding, but that would be very helpful to get some clear scientific data published to show how this works. Because unlike the Safer Supply program, which I commend them for trying, they were trying to save lives, and they have. Honestly, they have saved the lives of a good number of the patients who are on their program. It's just that the drugs are getting out and it's affecting other people. But I can say that this program saves even more lives, and I hope that we can get some evidence to really show it. So that's all I have to say, and I don't know if you have questions or
I think we do, Dr. Ryan. I'd like to, I guess I'll go to Councilor Peters first. I saw his hand. Councilor Kohler will follow. Go ahead.
Thanks very much, Your Worship, and thanks very much for the presentation tonight. Hear you loud and clear on the safe supply. I have two questions. What is your opinion on the advocacy that's been happening in the community for the development of a safe injection site? And is there anything that we can do as a council to help you? You made comment about getting the study published. Is there anything that we can do to help to advance the work that you've been doing? Thanks, Your Worship.
Great, yeah, thanks, Councilor Peters. So I want people to understand a safe injection site is very different from safer supply program. So I am all for a safer injection site. So all that is that we have a site for people to come and use whatever drugs they have safely, and it gives us an opportunity to educate them, work with them, and provide services for them. So I think that's wonderful. Really, it comes down to the details, how you run these clinics, because I've seen in places where it is a great resource. People come, they learn, they get healthier. In other places, it becomes a haven for selling drugs, misuse, crime.
Yeah.
It really depends on how it's done. So if done well, a clinic would have to be open a big portion of the day, because, you know, when people want to use, they want to use. It can't be like 9 to 5 and then, you know, that doesn't work. So if we're going to do this, I say we do it right. And yeah, we have the right people working in the building and outside the building, have assessments around, and you know, we do that right. So very different from safer supply, where doctors are giving large amounts of prescription opioids to patients so that they will not buy illicit drugs that are more likely to kill them.
Thank you, Dr.
And yeah, and in terms of helping, yes, we are looking for some funding to get a research assistant or a researcher to work with me to do this, because one, I don't have that much time, and two, I don't have that much experience in research, and I want whatever comes out, I want the research to be high quality. There have been research studies done by Safer Supply, and it is not high quality, and it really is something that is detrimental, I think, to the community. I would like to provide really good objective data. That's what I would like.
Thank you. Councilor Kohler.
Thanks, Your Worship. Councilor Peters talked a little bit about some of the stuff, but I've had the opportunity, somebody told me about your program, and shared some information, had the opportunity to look at it, and very excited about it. For me, I would like to see this as an alternative to a safe injection site, and money put into something like this versus a safe injection site. And I know I've still doing some research, but everything I've seen and some other people that I've shared it that are in the medical community are pretty interested in it as well. So I certainly hope to see some support to help move your program forward versus, because I'd like to see a cure rather than something that continues to allow people to continue to do what they've always done, right? So thank you very much for what you're doing, and I'm certainly interested to see what we can do in the future with it.
Well, thanks, Councillor Kohler. And no, I agree that my capacity and our capacity is getting to our limits. And so, you know, either the CHC is wonderful. So we may restructure what I do, because in addition to addiction, I do mental health there. So maybe we would expand my role there, or maybe we might need to hire more people. So I leave that to Laura and the people who get much more information than I do about how the system works. So I'm just here to do what I need to do.
We've got a couple other comments. We're over our time, but we've got a couple of other comments. Councillor Clark, quick as we can, answers as quick as we can, and Councillor Herbert.
Thank you, Your Worship. Through you to Doctor, I was just wondering typically how much a study like that would cost and how long it takes?
I would like a year-long study and a mostly full-time researcher. It would be in the 75,000. It's like someone's salary for a year. And, you know, you can get a very good person who has a PhD, or maybe someone who's just in their master's. So then there would be differences in pay grade. Honestly, it's hard to know. Someone with their master's could be excellent and very motivated, but I think in order to get quality, I think we would want someone who has had some experience, who's been able to publish and understand how to make the study effective without having holes that will be, you know, found later.
Councillor Herbert.
Thank you, Worship. Thank you. Well, I guess in my mind, what you're doing is basically what they're doing in the safe injection program. A nurse in the safe injection does all the documentation, follow-ups and everything, where in your case, you're doing the program. The safe injection site is provincially funded. So, and what you're doing, I believe you're asking us to fund it, what you're doing at your clinic. Is that the end goal? The end result is the same, taking care of the person on drugs.
Yeah.
But, and they both have benefits. But anyway, I'm on the public health. We've had a big discussion on it for quite a while. Woodstock said no, but then the provincial government said we're shutting the program down. But anyway, basically what you're telling me, you're doing the same thing as what they're doing here, except you're have a better control being a physician where the nurse does the program. I could be wrong, but that's just an interpretation I'm getting from your presentation. So thank you. It was a good presentation.
Okay, can I address?
Doctor,
address
please.
this? Well, so what we're doing is a bit different. So a safe injection supply is basically, you don't need a doctor because patients are just coming there to use their drugs safely. So what I'm doing is I meet clients and they tell me about their issues, and then I treat their addiction in various ways. I mean, it's not just like they walk in, I give them a shot, like, you know, there are different ways you have to do it, and it takes some skill. Honestly, that's why family physicians are reluctant to do this, because if we could get our family physicians to understand how this medication works and how to use it, they would be treating their own patients and then maybe taking on others, which would relieve the burden on us. But it is a bit tricky, and I get that. And so if I can, you know, get some funding to do a study to show how effective it is, and then maybe even provide training or teaching to people, that would be what I would want. So a little bit different. And if I can just say, the addiction is really just this first symptom of the problem, okay? And that's not where I stop. Like, I treat their addiction first so that they are more clear-headed. So then we can actually get to the real problem of why they are addicted in the first place. And that is the beautiful part of this medication, that I get them after a few months, they're ready to talk to me. And undoubtedly, everyone has some major trauma that they're dealing with. A lot of people have undiagnosed mental illness, schizophrenia, bipolar, you know, ADHD. Then I can start treating those things. And that is when we start to see the functioning. That's when they get back to work. That's when they can, you know, have housing and not get kicked out and have their children back. So it's a process. So it's not like a, yeah, I mean, the funding for the research is important, but we need teaching, we need qualified people to do the work of mental health, and that's been lacking, you know, sorely lacking for years.
Thank you, Dr. Mai. Real quick, Councillor Clark.
Yeah, I was just gonna say, we've got 3 members of the health unit board here tonight. Maybe that you can take that back to the health unit and see if there's any funding available for studies like this.
Well, I'll ask Dr. Mai, have you tried that route?
I think we have we not? Yes. So I don't know where we're at with that, but. Yeah, we've knocked on a lot of doors.
Right.
We are still waiting to see, and we've been fortunate to get some help from our social services colleagues here. And they pointed us in some directions that we are looking at, but.
Dr. Mai, I'm very interested in what you've shared with us tonight. Could you give me the approximate cost of a month's worth of help you're suggesting, using your method, somebody doesn't become unaddicted, but they become far more functional in their addiction? What's your
Far
cost?
more functional.
I got
So,
that.
so the
I
first.
want to know more.
The
please.
first thing is that luckily Ontario OHIP covers sublocated shot. It's $700 a patient, well worth it. If they don't have one overdose in a month, you get your money
We've
back.
got our money back.
You know what I mean? So OHIP is done the right thing about that. There are a small number of my clients who are the working poor, and we've kind of been creative in ways to help them, but that's another area that we could use some assistance because these people are already working. They just are missing a lot of work. We get them on the medication, they're working, contributing to society. They just can't pay the $700 a month, so that's
Okay.
another area.
Well, thank you for coming and sharing this with us tonight, and I've allowed it to go over because I'm quite interested. I'd love to have a one-on-one conversation
Sure.
with you about
Yeah.
how we may be able to advocate for you with a lot of other members of the funding source, so.
Yeah, no, this is great. Just to, I don't know if you guys individually or this council can do anything, but just being here to spread the word. And if you have connections in other areas to spread the word, that's what my hope is.
Thank you.
All right,
I'm
thank
going to
you.
give Councillor Kohler another quick question because he begged me.
Well, and maybe I'll wait until after your one-on-one with him, but I was gonna look at community engagement under new business to see what we could do to get a report coming back where we could help push this program forward. I think if we're gonna truly see something done, this is something that we have to look at, not continuing to feed the addiction, but how can we fix it? So
I agree with you, Councillor Kohler. There's so many ways of skinning this cat, if you will, out there, whether it's detox and rehab, or it's the methadone clinics, or it's safe supply, as you've mentioned. I don't know if any one of them is the absolute solution to anything from an opioid crisis point of view. But if we can add another tool to the toolbox, the methods you're using, then let's at least listen it out. And as you say, do some good research so we can share that good information through all, because you can't do it right now. You haven't got research to prove scientifically what we're doing is right. So love to help. Let's and thank you for coming and sharing with us tonight. Gives us a whole another thing to think about in a community that has a bit of an opioid crisis going on.
Right, and just 1 minute to answer or to talk
Go.
to that. So I have seen the results of methadone clinics and, other treatment safer supply.
Right.
And I'm involved in lots of forums with other addiction specialists right across the country. I can say that what we're doing here is far more effective. And that's why I want to prove this, because it's one thing for me to say to someone in Calgary, like, hey, we are doing really well. Our, emerge rates are going down, or, criminal activity is going down. And this is what I'm doing. They're like, oh, okay, sure. That seems pretty simple. I could do that, but no, we're going to keep doing it our way. But if I can show a paper to say, hey, this is for real, then that's a different story.
Well, thank you very much for coming tonight and sharing with us. Thank you for both of you on the deputation, and also my friend David Warden. You don't have to stay for the boarding part if you don't want. All right, thanks. Thank you. Madam Clerk.
Thank you, Your Worship. Good night to all who are leaving. Council will now resolve itself into committee of the whole to deal with the following business. First committee this evening is Strategic Direction and Development. First item relates to 225 Wellington Street. For the members' information, we have provided a copy of an amended decision from the Committee of Adjustment relating to B0523 application, just so that council is aware that the concrete ramp is now included in the retained lands. So then the next item is a letter of request for alterations received from Doug Terry Limited to bylaw 187/2014, which is a bylaw to designate 225 Wellington as a property of cultural value or interest. And I have a motion that the letter received from Doug Terry Limited relating to 225 Wellington Street be referred to the Municipal Heritage Committee for a report. Moved by Councillor Wookey, seconded by Councillor Clark.
Questions or comments? Seeing none, all those in favor? Any opposed? Carried.
The next several items are notices relating to a public meeting to take place by Zoom on February the 8th, 2024 at 10 a.m. from the Committee of Adjustment. The first application is for consent to create 2 vacant lots for employment purposes adjacent to 10 Highbury Avenue. And a concurrent minor variance application has been made to allow one of the lots to be accessed through a 10-meter wide easement over lands owned by the city. The next application for a minor variance to permit a deck and swim spa encroaching at the top of bank and geotechnical setback line area in the rear yard at 3 Royal Dornock Drive. The next application for a minor variance is to permit a sunroom 6.9 meters from the rear lot line, whereas the minimum rear yard depth is 7 meters, and that's at 69 Royal Dornock Drive. The last item is an application for a minor variance to permit a minimum lot frontage of 9 meters per dwelling for 5 semi-detached dwellings, whereas the minimum lot frontage is 10 meters, and that's on lots 34 to 39 and 44 to 46 on Plan 11M 261 on Stiles Drive. So your worship, unless the members have any further items under strategic direction and development.
Councillor Clark?
I had a call with some neighbors concerned about the CN property and some tree trimming and stuff going on. So they were worried that some action may be taking place in terms of that sale of that property. So I assured them that the Committee of Adjustment did not approve the severance. But I was just wondering on that topic, whether we've heard anything from our city lawyer, if there's any update on that whole issue.
Mr. Pompilli, will you or whoever wants to, or I'll take 2 of you. That's. I know you had originally started through this, but go ahead.
Yeah, through your worship to all of council. Kevin and I have both been working with a lawyer, and there's been some information exchange back and forth. And we are just making arrangements right now to find a date for the lawyer to come and make a presentation to council with his findings. And it should be coming up probably within the next 2 or 3 council meetings. We'll provide you with that update. But I've not heard anything about a sale of land, and we can look into some of the activity going on there. We were tipped off last week too that there was some activity there. So,
Okay.
Yeah.
Great. Thank you very much for the update and the pending time at council. Anything else under this committee? Seeing none?
We'll now move into community engagement and services. The first item under unfinished business relates to Lake Margaret ice fishing. I have a motion that report PRF 0324 relating to the Lake Margaret ice fishing be received for information. Moved by Councillor Wookey, seconded by Councillor McCauley.
Questions or comments? Councillor Herbert?
Thank you, worship. I noticed at our December 4th meeting, we approved that the fire service was retraining in ice water rescue. How does that work? Is that something that's been done for all firefighters, or just you have a specific crew that responds to these emergencies? Just a
Chief?
question.
Through you, your worship, to Council Herbert. Each and every member of the St. Thomas Fire Department is trained to the highest standard of ice water rescue. From the top right through the bottom, we just went through 3 of the 4 groups last week with what ice we had, and we'll continue this week with the final group. There's more water than there is ice, but the evolutions are exactly the same.
Just curious to see, everybody did it. If you didn't have a special crew that did it, that would show up. That was my question, but thank you.
You're welcome.
Councillor Peters?
Thanks, your worship, to Jeff Bray. Jeff, how do we ensure public safety? Someone cuts a fishing hole in, starts ice fishing, may not freeze right over, and a child walks over the hole and goes through, because ice fishing holes aren't 6 inches round. I've ice fished and they're 18 inches or so. So how do we ensure public safety? And I'd like a recorded vote on this too, please.
Mr. Bray?
Through you, Mayor Preston. As noted earlier, park staff are not trained to check the ice thickness or trained in ice safety. Ice safety is incumbent upon people using the ice to call in fire rescue or residents who notice someone in distress to call in fire services.
Mr. Bray, if I can jump in. I know that this council, we said, okay, fishing on Lake Margaret is an okay thing, and we've said not between March 1st and June 30th, the spawning time for bass, the most prevalent fish in the lake. Is there a way for us to safely say excluding ice fishing? I mean, there's some inherent dangers to going out on ice, as we've learned from the chief. I hope, the fact that we've trained every one of our firefighters in this ability, I'm not sure I would want anyone to have to use that service. All right. And I understand your staff isn't trained to come out and check that either. Also in our fishing bylaw, it says fishing can only happen in the west reach of the lake.
Correct.
Now, does that include that ice fishing can only happen in the west reach of the lake? Or once the ice is frozen, does that mean I can now go fish anywhere in the lake?
Ice fishing can occur anywhere. It's fishing with a rod that is restricted to the west side of the lake. And that is for privacy of residents and safety of people using the trail.
Perfect. I'll go to Councillor Wiki.
Thanks, your worship. This is something that's near and dear to my heart and has been for a long time. And I thank Mr. Bray for bringing this forward. And it was all about, spawning season, all that kind of stuff. So the fact that it doesn't, the fish don't spawn until March, April allowed for this to happen through logic, common sense. As far as safety on the ice goes, I understand what people are saying, but I skated in Pinafore Pond when I was a kid, and we are out on the ice, and I don't see much of a difference. Notwithstanding the hole in the ice, between this and anything else. And for me, it gives people another opportunity to be outside and be active. And that's what I'm really interested in, of course, within the reasonable boundary of safety. Having said that, again, I was skating on Pinafore Pond as a kid, and we were lucky. We had somebody the dad who would go down and literally drill through and check the depth of the ice, and he'd give us the thumbs up, and we'd be out there doing our thing. So I thank Mr. Bray for bringing this forward. I strongly support recreational activities, and I think we have to trust in our community that people are going to use the ice safely. And I think we're all aware. Anybody that's ever skated on a pond is aware of the situation. Thank you.
Further questions or comments on the report? Councillor Herbert.
Thank you. I was just kind of thinking out loud to myself. When you go to the beach at Port Stanley, they put up red flags saying, don't swim at your own risk. Do we do something like that at Lake Margaret? Could we put up signs? Stay off the ice?
Well, as Mr. Bray has said, he has no staff that can do that and can test the ice thickness or has been trained in that, but you're asking for that.
Just to put up a sign to say ice, dangerous ice, don't go on it. Now,
How many
someone-
approaches to Lake Margaret are there? Mr. Bray, maybe you can help me with this. Because one sign probably is not going to do that.
Thank you, Mayor Preston. We do not do that. We put up warning signs about ice, and access is pretty open on the north side from Pinafore across to the west side and around to where the residential area starts on the south side. There's various access points where people can get onto the lake, also from John Waite Park as well.
Councillor Clark.
Thanks. We have ponds all over the city. Lake Margaret's not the only one.
Yep.
So we'd be putting signs up everywhere. What's next? Signs don't go down the hill because you can't toboggan here on a city hill because it's too icy. I mean, I think we have to rely on people's common sense, and you can't legislate everything.
Okay. Further questions or comments? Seeing none, all those in favor, you wanted a recorded vote on the report.
Councillor Baldwin Sands,
Yes.
Councillor Clark,
Yes.
Councillor Gibson,
Yes.
Councillor Herbert,
Yes.
Councillor Kohler,
No.
Councillor McCauley,
Yes.
Councillor Peters,
No.
Councillor Wookie,
Yes.
Your worship,
No.
your worship, the motion is passed.
Yep.
I'm moving on to new business. The next item relates to participation in the Infant and Early Years Mental Health Project. I have a motion that report SCSS 0324 relating to the Infant and Early Years Mental Health Project be received for information, and further the council approve the recommendation in report SCSS 0324 by entering into a memorandum of understanding as set out in the report, and further that a bylaw be prepared authorizing the mayor and clerk to execute a memorandum of understanding with Compass Early Learning and Care. I moved by Councillor Kohler, seconded by Councillor Wookie.
Questions or comments on the report? Councillor Herbert.
Thank you, worship. I found this report very, very interesting. When we talk about infant and early years mental health project, man, that's an eye opener for me when we're talking infants. But anyway, I plan to come in to speak to you later on because I do have a bunch of questions, but the only one I really would like to a little expansion on is that deep dive training. I know you've mentioned it later on, but I'm not sure what it really all curtails. So thank you.
Sure, I can give you a little bit of a background. Thank you for the question very much. So we're still in the infant stages of creating this. What this deep dive training is, we will be identifying individuals in all our childcare programs to champion this mental health training. This deep dive training is for them to become the champions and train the trainers for the staff to bring that information. Our goal is to ensure that we have people that are really committed to understanding what mental health is for infants and to be able to take that information through this training to give to the rest of the staff that are in the childcare, to give that information and to give to parents and families and anybody else in the community. So that's what that deep dive training, it's called that. Again, we're still working through that because we're still very early, but that's what it is. It's a kind of a train the trainer module, and it will help to get the information out to everybody and not just those that are interested in it, but those that need it.
It's kind of a catchy phrase. Thank you very much.
Further questions? Seeing none, all those in favor? Any opposed? That's carried.
Your worship, unless there are any further items for this committee?
Councillor Clark, of the additional item tonight, yes.
Yes, thank you. Just wonder if we could get an update on Pinafore Park and the bubble that we were trying to procure an arrangement with different companies for the tennis and the pickleball.
Mr. Bray, I think that's you again.
Thank you, Mayor Preston, through you to Councillor Clark. The RFP has been prepared for a bit. We've had some staffing delays, but it'll be released this month.
And just to follow up, would the bubble stay year round, or what would they do in the nice weather?
Once it turns nice, the dome is removed and stored, all at the expense of the proponent.
If I can ask on that same one, you said an RFP. I was under the assumption that it was a pickleball group that was going to pay for this and then charge other users to use it. Does this now become a city?
No, it's, there's two groups out there that we're aware of that they run a business model installing these in outside facilities, and then they run their programs through the months when the courts are typically gone fallow.
So we would be running the pickleball piece,
Correct.
right? But
Yeah.
they would be paying for us to be able to do that?
When the dome is up, they run it, and that's how they generate revenue.
Super.
When it comes down, it reverts back to the city and we run our programs.
Excellent. That's what I thought it was, but
My apologies for interrupting.
no worries.
Yeah.
Further questions or comments on the point from Mayor Clark? I've given you two promotions tonight. Yes. Thank you for filling in. Yes. Any other items for this committee? Seeing none.
We'll now move into infrastructure and civic operations. The first item relates, under unfinished business, relates to the Lake Erie Resource Protection Committee member nomination. I have a motion that report ES 0624 relating to the nomination be received for information, and further, the council support the nomination of Alex Piggott, Manager of Environmental Services at the Municipality of Central Elgin, as municipal representative for Group 7 on the Lake Erie Resource Protection Committee. Moved by Councillor Gibson, second by Councillor Clark.
Questions or comments? Seeing none, all those in favor? Any opposed? That's carried.
Next item under new business is the wastewater master plan update. I have a motion that report ID 0424 relating to the wastewater master plan update endorsement be received for information, and further, that council endorse the findings and results of the wastewater master plan update. Moved by Councillor Wookey, second by Councillor Gibson.
Questions or comments? Councillor Wookey.
Thank you very much. I have a question. As our neighbors start to build more, what is the nature of the agreements that they can access our wastewater treatment? Like where, what is the extent of that? I guess my point is like, let's say down on Sunset, they put up 3 apartment buildings. Do we get to say no when we're at blank capacity, at blank percentage, or what's the nature of that agreement? If you can help me with that, because to me, it's obviously has a lot to do more than just with us. Like this is the whole area really that might be relying on this. And so this gets to be far more pressing than just what we're doing within St. Thomas. Thank you.
Mr. Lawrence, great to have you here.
Thank you. So your question is related to sewage provision for neighboring municipalities. Is that correct? Okay, so there's an agreement with Southold and there's an agreement with Central Elgin, and it defines basically areas that can be drained into the city. And then there's also a limit on the total volume from those areas. So those agreements, the Southold one is 20 years old. The Central Elgin one's about the same. In theory, if Central Elgin had a new apartment building and they sign a site plan or a subdivision agreement, we can book that capacity. So we give them the rights to that capacity to drain in. It's a first come, first served basis for whether it's Central Elgin, Southold, or St. Thomas. And we book that capacity up to the theoretical maximum in the city. So 80% is what we're booking to at this point. We're currently at 65. And with the plans that we see on site plans and subdivision, it goes up to about 75%.
Thank you. Now, you said these are older agreements. They're perpetual? There's an end date? There's a renegotiation? Because to me, we are opening ourselves up for a lot of challenges here if we can't massage this agreement given our own capacity issues and our own priorities. Any comment on that? Thank you.
Please, I'll try or you go.
You'd have to see the areas in question. So for example, for Southold, there's only a small area remaining, and that area drains through Lyndhurst. And so it's unlikely that they'll develop that and drain that towards St. Thomas. For Central Elgin, they have a few more areas. But it's not unlimited. It's not a ring around the entire city. It's specific areas to specific volumes, and the agreements are perpetual.
That's good. Councillor Herbert, then Councillor Clark.
Yep. Thank you, Worship. Yeah, you've down shortlisted to 3 locations. Is there a time frame when you have to make a final decision?
Yes, so we're now into the Class A part and preliminary design. Our strategy is to develop each of the 3 options to seek just to make sure that there's no stumbling block with one of them. Maybe one of them rises to the top, and we'll select that within the next 6 to 9 months. We'll make that selection, and we'll seek council's endorsement on the final choice. When you get the final choice, then you know specifically how to pump, where the pipes need to go, and then we start into a property acquisition process at that point.
Counselor Clark?
My question was similar to Councillor Wookie's in terms of what does the new pumping station, once it's up and going, how does that impact the current agreement that we have with Central Ogden? I realize it's only going to concern certain areas once they're full, but what impact will the location and the new pumping station have on that agreement?
Mr. Lawrence?
So it won't have any impact. So the existing limits that are in the sewer agreements will stay existing limits, and so will the areas. So they don't gain any new area or new capacity from this unless council provides it to them.
Further questions or comments? Justin, can I ask one, please? The capacity of the new plant compared to, say, Sunset, what will in your mind, we have to design that plant still, I understand. So will it be twice the size of Sunset?
The existing plant is 27 megaliters a day. The new plant in theory will be 25 megaliters per day with the ability to add another 25 on top of that.
So it could be 50, but it's a scalable project.
That's right. And it could be scaled at any time. So we'll do the study that allows for the full 50. We'll build any critical pipes to the 50. We'll buy property to size the 50. The only limiting factor then is when it comes to the cost of the construction. So that will be the choice that council can make in the future. Do you want to build the 25 or the 50?
Okay. I'll go to Councillor Clark. I may have one more. Go ahead.
Given that we're opening up our stage 1 in the north and we still have 2 and 3 what percentage would all 3 of those take up of the remaining room on the current sewage plant?
So as I was saying, we're running at 65 today. We think there's, with all the projects on the horizon that are just about to be signed off as a site plan of subdivision, we'd be at about 75. That includes the power code development to get to the 75. However, if you look ahead to things like Area 2, 3, 4, various other infill projects that we know about, we will be reaching the capacity of the plant within 4 to 5 years. And so at that point, at the 4 to 5 years, it becomes a lot tougher to approve new developments if you know that you're at your limit.
It's great that your dates meet the 4 to 5 year. So we know where we want to be in order to grow. The capacity that we're planning for ourselves, and I won't hold you to this because I don't think either of us will be here. At what year will we use that up in growth?
So the full
What
20,
are we planning for? 50 years?
the 20, it depends on population growth and development growth. Industrial development uses kind of a disproportional amount compared to residential. So it really depends on the type of industries that we get. Some are very, very heavy users and some are light. So that'll be the key determinant. But I think you would want to go to a minimum of 25 years. And so the 25 should accommodate that with no problem.
Okay. My other question is, a great deal of timeline in here is about pre-design and then design. Is there that big of a difference depending on where a wastewater treatment plant is sitting? Or can this design be an off the shelf? Or can this design be pre-done to save ourselves a couple of years in this timeline?
It's a good question. And we're sort of doing that strategy. So we're doing 30% of the design as part of the Class EA.
Right.
So as part of this planning process in the next 6 to 9 months, we will be designing a plant. Past that point, it's a bit uncertain. So you need to know where the outlet is, the size, so you can do the aspect ratio of the plant.
One last one from my chair today, because wastewater seems to be controlling my life lately. The work we're doing this year on the wastewater treatment plant on Sunset, will it get us any more capacity? I know a lot of it was odor control and some other things, but will we end up with more capacity after this year's work?
Functionally, it will provide some more capacity. From a listed regulatory capacity, it's unlikely to change. So
Okay.
on the books, technically, it will be the same capacity, but functionally, in theory, you could run it at a faster rate.
Okay, great to hear. Thank you. On the report, what further questions or comments? Seeing none, all those in favor? Any opposed? Carried.
Next item relates to the South Edgeware Booster Station, pump and controls. I have a motion that report ID 0524 relating to the South Edgeware Booster Station pump and controls and Gorman Rupp be received for information, and further that the quotation submitted by Gorman Rupp of Canada Limited in the amount of $2,863,151 excluding HST be accepted. Moved by Councillor Kohler, seconded by Councillor Gibson.
Questions or comments? Councillor Gibson.
I'd just like to thank the staff for looking at our back door here, getting someone in our area for the parts that we're going to need. Thank you.
Great. I liked it when I read the name too. Justin, this isn't the whole cost of this project though. This is purchasing the pump. Is that correct?
That's correct. So this is the pumps, the big valves on either side, the electrical controls, and all the electronic systems that run it. So it's the vast majority of the water pumping station, the mechanical parts, but we still have to build the building.
Sure.
The project itself is in the range of $10 million.
Thank you. Further questions or comments? Seeing none, all in favor? Any opposed? Carried.
Next item relates to Layla Street Road closure. I have a motion that report ES 0324 relating to the Layla Street Road closure be received for information, and further the council authorize administration to undertake the administrative actions and notifications to close a part of Layla Street, and further the council direct that a bylaw be prepared for its consideration to amend traffic and parking bylaw 45-89. Moved by Councillor Wookey, seconded by Councillor Herbert.
Questions or comments? Councillor Gibson.
Yes, with the redesign of the area there, are we going to allow public access if there's going to be an actual asphalt trail there or a soft trail that's going to be there? Because it would be really nice if it was even available for bikes, because going down the hill is quite dangerous, I find. I've only done it my one time and I would never do it again. So I would truly miss that little access there going down.
Kevin, welcome. Is there any way for us to use any piece of a closed Layla Street?
Through the mayor to Councillor Gibson, that's exactly the intent, is to convert this area into a multi-use trail in order to provide that active transportation connection, but not for motor vehicles any longer.
Go ahead.
So, so when you go off Ross and you go down, could we have a yield sign for the bicycles? So when they come down, they're not, it's either a stop sign or a yield sign for traffic coming down. You know what I'm saying? Because when you're coming off that pathway, going down onto the other street there, Maple, thank you, Councillor. I'm scared that if I was on a bike, your bike has mirrors you can see on either side if you're properly riding your bike. But there's going to be a blind spot when you come down and coming onto Maple Street.
Through the mayor to Councillor Gibson, yeah, we can definitely include some type of signage or notification so that we don't have a bicycle collision.
Further questions or comments? Seeing none, all those in favor? Any opposed? Carried.
Next item relates to Kane Street Reconstruction Tender Award. I have a motion that report ES 0524 relating to the Kane Street Reconstruction Tender 2024-002 award be received for information, and further council award tender 2024-002 to GHN Group in the amount of $4,161,964 excluding HST. And further, the council endorsed the conversion of Scott Street and Curtis Street from one-way traffic to two-way traffic. And further, that council direct a bylaw be prepared to amend the traffic and parking bylaw 45-89 accordingly. Moved by Councillor Wookey, seconded by Councillor Gibson.
Questions or comments? Councillor Peters?
Thanks, Your Worship. I'd respectfully request that clauses 3 and 4 be separated, dealt with individual or collectively, and a recorded vote taken on clauses 3 and 4. Thank you.
Councillor Wookey?
Thanks, Your Worship. This is kind of just a general public service announcement. I went to see some constituents today about an issue and got talking about some of the stuff. And I said, this was coming up in open session tonight. And I say, we went through a process, several years back where we started to do our budgets earlier. And because of that, we're able to get these tenders out in the street earlier. And because of that, we get really good pricing. So I want to thank the staff and just say to the public that we save a boatload of money every year by getting these out in the street earlier. And I'm very proud of that, what we do as a city, because when I see other municipalities, I love other people's politics. And when I see other municipalities and they're still scrapping over the budget in March, and by then we're starting our projects, I appreciate the professionalism with which we go about this. So I just want to say that to anybody who's listening, that this saves taxpayers a boatload of money every year. So thank you to staff.
I echo what Councillor Wookey has just said. If you start to watch the RFPs come in now, or the proposals for projects for this year, we're saving enough for another project, we hope, at the end of the year. So great work. Further questions or comments? Councillor Herbert.
Thank you, Worship. Well, my question is for the second part, the changing the one-ways to a two-way. I had asked a few meetings ago about John Street, when it was switched to a two-way for the construction. Just what the result was. Was it a good idea? Were there complaints from those people? And if there were the people on Curtis and Scott complaining, given the same complaints? I don't think it should be a two-way. Those are my questions. I was curious about John Street for sure. So anyway, thank you.
Through the mayor to Councillor Herbert, we did not go through and survey the people on John Street to find out if they were supportive or not supportive of the conversion on John Street. So I don't have that information for you, unfortunately.
Am I correct? If we hadn't made John Street two-way, people wouldn't have been able to get to their homes because it was one way from Talbot and we closed Talbot.
During the time, yes.
Yeah. Okay.
Just to follow up, Your Worship. My only basic question was, if there are issues on John Street, are we going to have the same issues on Curtis and Scott? I'm assuming there's not. I haven't heard anybody complain to me about it, but you'd just be curious ahead of time to make sure that if there's people complaining, we can deal with it. So thank you.
Am I correct? We, this council had a transportation study and a road use study that included Scott and Curtis Street turning into two-way traffic. Was suggested to us at the time of that transportation study?
Through the mayor, that is correct.
Okay, so we've had this for 3 years to discuss, but but you're right. We'll listen to the people there, but the transportation study we did told us that we'd be better off with the two-way traffic on those two streets. Further questions or comments? So on.
Your Worship, there's a request for a recorded vote on clauses 3 and 4. If we could do clauses 3 and 4 at this time, and I'll read them again if you like, Your Worship.
Go ahead.
Clause 3, that council endorsed the conversion of Scott Street and Curtis Street from one-way traffic to two-way traffic. And further, that council direct a bylaw be prepared to amend the traffic and parking bylaw 45-89 accordingly.
On that one, Councillor Clark.
Well, I'm just wondering whether we have consensus to move forward in that direction.
You mean splitting how we're voting on it?
Yeah, we've had a request, but we haven't confirmed that we want to go in that direction.
Madam Clerk, how are we on this?
Your Worship, the request is simply made for the recorded vote on that. So if council can vote on those two clauses by recorded vote, and we'll have the remaining two clauses dealt with separately. There's not a seconder required for a request.
Thanks for the clarification.
Councillor Herbert, real quick.
Yes, so we're voting just on the project, accepting it, and the
No.
two-way street will be,
No, but what we'll be voting on next is the part that includes Scott Street and Curtis Street. And with that, there would be need to change traffic and parking bylaws on those streets. So those two have been put together in a recorded vote. That's what we'll be voting on first.
yeah, because I was just, my question to the city engineer was if there's a lot of complaints, would I want to vote yes right away until I hear it, or, but that's not what you're saying here, right?
No, we're asking us to vote on those changes.
Okay, that's fine.
Councillor Clark?
We read the motion again, please.
Sure.
The motion is that council endorse the conversion of Scott Street and Curtis Street from one-way traffic to two-way traffic. And further, the council direct a bylaw be prepared to amend the traffic and parking bylaw 45-89 accordingly. Your worship, if we're ready, I'll take
I
the,
got a question or
one more?
comment from Councillor Peters.
Thanks very much, your worship. Notwithstanding the transportation master plan, I believe the public, even though we had public open houses, that this was laid out in, I don't think the public fully grasps what is happening here. I'm concerned, I've been long concerned about Scott Street being a speedway. But my advocacy for slowing down traffic on Scott Street has never been to turn Scott Street into a two-way street or convert Curtis Street into a two-way street. I don't think, I watch emergency vehicles use Scott Street on a regular basis. And the easiest, if an ambulance is coming from the North End Station or the fire department is coming from the North End Station, they do not go to Talbot Street. They do the jog and they come down Kane Street onto Scott Street. It is the quickest east to west route there is in the city. And I think we're doing nothing but going to slow the traffic down more than what we would like to see it slowed down. Scott Street is a disaster. I'd be prepared to look at this when we finally get around to rebuilding Scott Street because of the width of Scott Street. Curtis, I think, is a little more doable because much of Curtis has been rebuilt. But I just have some serious concerns of the conversion about these two streets, and I will not support. Thank you.
I agree. On this recorded vote, please.
Councillor Baldwin Sands,
Yes.
Councillor Clark,
Yes.
Councillor Gibson,
Yes.
Councillor Herbert,
No,
Councillor Kohler,
Yes.
Councillor McCauley,
Yes.
Councillor Peters,
No.
Councillor Wookie,
Yes.
your worship,
Yes.
your worship, the motion is passed.
So now-
Going back, going back to the first two clauses, I'll read those again, your worship.
Okay.
That report ESO 524 relating to Kane Street reconstruction, tender award be received for information. And further, the council award tender 2024-002 to GHN Group in the amount of $4,161,964 excluding HST.
You need a mover and seconder for that?
I have Councillor Wookie and Councillor Gibson.
Thank you. And questions or comments on this portion? Seeing none, all those in favor? Any opposed? Carried.
Next item relates to Meehan Street and Dieppe Drive reconstruction tender award. I have a motion that report ESO 524 relating to Meehan Street and Dieppe Drive reconstruction award. Just checking the number. Number 2024-004 be received for information, and for the council award the tender to GHN Group in the amount of $1,867,747 excluding HST. And further, the council endorsed the removal of parking on Meehan Street in favor of transit priority. And further, the council direct that a bylaw be prepared to amend the traffic and parking bylaw 45-89 accordingly. Moved by Councillor Wookey, second by Councillor Clark.
Questions or comments? Councillor Gibson?
So the 6 parking spaces that are there, up to 6 spaces, are they being used by the residents themselves, or they're just assumed that they're being used by people visiting the hospital?
Mr. DeLebeck?
Through the mayor to Councillor Gibson, I can only provide anecdotal comment that typically they're used up for hospital uses more so than by local residents, which is why we get some complaints from residents about cars being parked there for long periods of time.
Okay, further questions or comments? Seeing none, all those in favor? Any opposed? Carried.
Unless there are any further items under this committee, we'll now move into corporate governance and administration. First item relates to 2024 court security and prisoner transport program funding. I have a motion that report TR 0224 relating to 2024 court security and prisoner transport program funding be received for information. And further, council direct that a bylaw be prepared authorizing the mayor and clerk to sign an agreement with the Ministry of the Ministry of the Solicitor General for funding from the court security and prisoner transport program. Moved by Councillor Wookey, seconded by Councillor Kohler.
Questions or comments? Councillor Herbert?
Thank you, Worship. But my question would be, and I see Mark is gone, but what would happen if for $50,000 more than what we're funded? Does it come out of the police budget? Or does it come out of the city's budget? If it's 50,000, if it happened to be 750,000, they have a bad year.
I don't have a treasurer here tonight either to answer.
I'm
Hello, Mr. Treasurer. I see you now. Please, Dan, go ahead.
Thank you. The money we get isn't meant to be 100%. We get what we get, and the rest is paid for through the police services budget. It's never fully paid for so far from funding from the province.
Supplementary, please go ahead.
Follow-up question. I noticed in the report, and I find this interesting, that if we only needed $500,000, we have to return what we don't use or figure it in our next year's budget. So it just seems kind of funny that you have to return it if you don't use it, but anyway. I saw that in the report.
Councillor Kohler?
Thanks, Your Worship. I'm sure if he looks at the police budget, he'll see that it's probably far exceeds that, but I want to commend the Police Services Board to continue with the special constables and things like that, because it'll help that funding go that much further with you guys continuing to do that. I know we started that several years ago, but that'll help stretch that money a lot further.
Great. Further questions or comments on court security and transportation? Seeing none, all those in favor? Any opposed? Carried. Thank you, Treasurer.
Next item relates to the Kinsman Club requests. I have a motion that report TR 0324 relating to Kinsman Club requests be received for information, and further, the council exempt the Kinsman Club from the fee provisions of section 6 of bylaw 23-2002 concerning the licensing, regulating, and governing of the sale of goods. And further, the council permit the Kinsman Club trailer to be parked on city property from May 22nd, 2024 to June 23rd, 2024. Moved by Councillor McCauley, seconded by Councillor Gibson.
Questions or comments? Councillor Wookey?
Thanks, Your Worship. This is not associated with this application so much as the topic. And every year when we have 5 days of fireworks and my dog freaks out for 5 days, I go through the kind of same thing. And I don't want to be a downer on celebrations, but just anecdotally for us, I'd love to have a little wee handout when people buy fireworks, just to say, by the way, this is when you should be using them. It might not make any difference, but I'm stuck because I want to support all this, and the Kinsmen do such great work, but it's also pretty traumatic for parts of people in the city. So I just want to just say that idea is still in my mind. Thank you.
You keep that in your mind, Councillor Wookie, because I think we're going to see a report on days and use of fireworks coming to us very shortly. Chief, did you want to give us a preview or a spoiler?
Through you, your worship, to Councillor Wookie. We are working on a report. We actually have a report ready to go. I'll have it for your last council of February. In that will be some changes to the original bylaw that's there and some topics of discussion of where we go forward, what we add and how we add it, and at the discretion of the fire chief and his designate of what's allowable and what's not allowable.
Great, Councillor Clark, but great idea. And I know Councillor Herbert talked to me about it before the meeting. Councillor Clark?
I just wonder what percentage of the transition funds represent the cost of the full project?
We're on the.
We haven't voted on the Kinsman.
sorry.
Next one.
And I'm sure
Yeah.
they'll give you any money you need for any project. They love to help out the optimists.
I'm just trying to stay ahead of the game.
On the Kinsman Club report, further questions or comments? Seeing none, all in favor? Any opposed? Carried.
Next item relates to transition funding support from the Ministry of the Solicitor General for Next Generation 911. I have a motion that report FDO 224 relating to the transition funding support be received for information, and further that council direct that a bylaw be prepared authorizing the mayor and clerk to sign the transfer payment agreement with the Ministry of the Solicitor General for Next Generation 911 transition funding support. Moved by Councillor
Anticipate a
Wookie,
question from
seconded by
Councillor
Councillor Clark.
Go ahead, Councillor Clark.
Karnak.
Yes, it was.
So the question still remains, what percentage of the project will get covered off by this amount of funding?
Chief?
Through you, your worship, to Councillor Clark. Right now, we are in the first stage of E911, which should be up and live February 24th, I think is the date. We are at a percentage, I would say we're at 75% complete of the whole project. This next funding will put us to all the little, and it's very flexible. And if you read into the Solicitor General's requests through the mandated, federally mandated timelines, there is some flexibility for training, some licensing fees, and we have all the hardware that's set up, the servers, the computers, the backbone, Bearcom, Netagen, and Bell have all been working together to get us to where we are now. So this, and hopefully we can use all of it. If we don't, through our treasurer, we will have to return it, but hopefully we can use all this through licensing, training, and get to where we are. We have not had to reach out to the city at any point through this transition for funding.
Okay. Councillor Peters? Did you? No? I saw somebody else's hand, but we may have answered the question. Thank you, Chief. All those in favor? Any opposed? Carried.
Unless there are any further items from the members for this committee? Council will now reconvene into regular session. I have a motion that the recommendations, directions, and actions of council and committee of the whole as recorded in the minutes of this date be confirmed, ratified, and adopted. Moved by Councillor Clark, seconded by Councillor Gibson.
Questions or comments? Seeing none, all those in favor? Any opposed? That's carried.
No reports of committees this evening. We now move into petitions and communications. The first item is a request for a proclamation, flag raising, and jumbo lighting from Sherry Bishop relating to World Autism Awareness and Neurodivergent Awareness and Acceptance. I have a motion that Council of the City of St. Thomas proclaim April 2nd, 2024 as World Autism Awareness and Neurodivergent Acceptance Day in the City of St. Thomas, and further that the World Autism Awareness and Neurodivergent Acceptance Day flag be flown at City Hall from April 2nd to April 7th, 2024. And further, that the Jumbo Monument be lit in blue from April 2nd to 7th in recognition of World Autism Awareness and Neurodivergent Acceptance. Moved by Councillor Clark, seconded by Councillor Alderman Sands.
Questions or comments? Seeing none, all those in favor? Any opposed? That's carried.
Next item, resolution, a copy of a resolution has been received from the municipality of Tweed regarding provincial license plate registrations and renewal fees. Next item, a resolution, copy of a letter addressed to the Honorable Prime Minister from the city of Sarnia has been received regarding the federal carbon tax. The next item, a copy of a letter addressed to the Honorable Doug Ford Premier and the Minister of Transportation has been received from the town of Mono regarding road and traffic safety. Next item, a letter has been received from the Association of Ontario Road Supervisors requesting support for a provincially funded municipal equipment operator course. Next item, a letter has been received from the Catfish Creek Conservation Authority regarding the authority's programs and services guide and providing a final progress report to the Ministry of the Environment, Conservation and Parks regarding the implementation of a transition plan under Ontario Regulation 687/21. Next item is a letter received from the Ministry of Environment, Conservation and Parks thanking Mayor Preston for a meeting at the recent 2024 Rural Ontario Municipal Association Conference in Toronto. And the next item is a notice received from the Ontario Ministry of Transportation and Stantec Consulting Limited of the completion of a preliminary design, detailed design, and class environmental assessment study relating to Highway 4 widening and proposed Talbotville bypass and Highway 3 twinning. Next item is notice received from Hydro One of a notice of commencement of a class environmental assessment for the St. Thomas Line project for a new transmission line between St. Thomas and London. Community open houses relating to the project are scheduled for February the 21st from 3 to 8 at St. Anne's Parish on 20 Morrison Drive, and for February the 22nd, 24, from 3 to 8 at the Belmont Arena and Community Center at 14020 Belmont Road. Your worship, that concludes the petitions and communications on the agenda. Unless there are any further items from the members, we'll now move into unfinished business of council. And seeing no items from the members, we'll now move into new business of council.
Councillor Herbert.
Thank you, Worship. A few weeks ago, Your Worship, Mayor and Councillor Clark and Senator Barris and myself attended the Roma in Toronto. And we left there, I think, really on a high note. We talked about schools in St. Thomas. We talked about the Hydro One project, and we talked about tiny homes, and they made us really feel like they were listening to us, and it may be something on the horizon. So it was a very informative conference. So just wanted to point that out. And the clerk just mentioned about the open house for Hydro One. If people are listening, they should attend it. It's going to be a very interesting. We had that presentation too, which was very, very interesting for us to have that. So, but anyway, it was a great thing for us. So I certainly enjoyed myself. A lot of good information, and hopefully in the next month or two, something will happen for us in those directions. So anyway, thank you.
Councillor Kohler.
Thanks, Your Worship. I just want, with your one-on-one with Dr. Mai, if that can be reported back, whether a report will be coming to council or if one needs to be requested from council to have that once you've had a chance to have your meeting with them.
I'd be happy to share after we've had a conversation. Sure. More information. Other new business, Councillor Warkey.
This is just an internal thing. Just I want to thank the clerk's office because this eScribe program is very handy. It's saving me a lot of hassle trying to scroll through 85 pages of stuff to find something. So thank you for
Had a lot of fun with it tonight.
Yeah.
Too. This is
thank you for giving me like an hour back of my life this week from just scrolling.
Sorry, but at my age, that's a pretty precious hour. So thank you, Counselor Wiki, for saying so.
Even, your worship, even the ultimate Luddite and Steve Peters likes the new program too. I may actually give up paper for this.
Counselor
And
Kohler?
I'll go on the record too, because I said to Marie, I said, I want antidote back, but this is much better. It's just, we got to keep it so it'll stay in a place because I keep going back and forth here, but no, this is a much better
No,
system.
I've been able to keep pace and participate tonight. Maybe you want to take this off my computer because then I won't speak as much. I had a piece of new business that on last Friday morning, Groundhog Day, February 2nd. I'd like to thank Councillor Herbert and Councillor Gibson and Councillor Peters for, I got us all right. We had fun at our new groundhog ceremony here in St. Thomas. For those of you at home that don't know, we have a groundhog as part of a mural, a 35-foot groundhog as part of a mural on the back end of Westlake Evans Park. And we came up with having a number of us that visited Wyerton last year on February 2nd and said, we can do this. Now we have a groundhog. Well, it was a kind of last minute, good crowd for the first time we had one. We had a great conversation with the groundhog, which I want to thank Councillor Peters, because we had kind of talked about whether it's Tommy the groundhog or St. Thomas the groundhog. And he suggested Sally. And with a quick bit of research, we found there is not very many weather procrastinators, right? That are female. Well, there's Lucy the lobster I found. So there is, right? But she's not a groundhog. So we chose, the committee of the day chose, and it was not an official meeting of council, so I can let the clerk feel comfortable with it. We chose Sally, St. Thomas Sally, as our groundhog, and put out some pretty good social media that morning. Graydon Lang was with us, so he recorded the event. And I expect to see you all up bright and early next year. And we will discuss whether fireworks will be allowed or not. Maybe we can get it in the chief's report. I'm just sharing. All right. Thank you. Any other new business from anyone? Seeing none, moving on.
We'll now move into bylaws. I have a motion that leave be granted to bring in the bylaws. Moved by Councillor Peters, seconded by Councillor Gibson. Thanks.
Questions or comments? Seeing none, all in favor? Any opposed?
I have a motion by Councillor Peters, seconded by Councillor Gibson, that the bylaws be now read a first time, referred to council and committee of the whole, and read a second time.
Questions or comments? Seeing none, all those in favor? Any opposed? Carried.
Go ahead, Madam Chair.
First bylaw, please.
First bylaw is a bylaw to confirm the proceedings of the council meeting held on the 5th day of February, 2024.
Questions or comments? Seeing none, all in favor? Any opposed? Next bylaw, please.
That bylaw being carried, we'll move to bylaw number 2, a bylaw to authorize the mayor and clerk to execute and affix the seal of the corporation to a certain agreement between the city and Doug Terry Limited. This relates to site plan file for 175 Manor Road for a 24-unit townhouse development.
Questions or comments? Seeing none, all in favor? Any opposed? Next bylaw, please.
That bylaw being carried. Third bylaw is a bylaw to authorize the mayor and clerk to execute and affix the seal of corporation to a certain agreement between the city and Geography 312 Incorporated. This relates to site plan file for the property at 4 West Pearl Street relating to a 3-story apartment building with 23 units.
Questions or comments? Seeing none, all in favor? Any opposed? Carried. Next bylaw, please.
The fourth bylaw is a bylaw to authorize the mayor and clerk to execute and affix the seal of the corporation to a certain agreement between the city and Eastwood Housing Corporation. This relates to a site plan file for the property at 220 Highview Drive, 5-story affordable housing building with 82 residential units and 1 retail unit.
Questions or comments? Seeing none, all in favor? Any opposed? Carried. Next bylaw, please.
5th bylaw is a bylaw to authorize mayor and clerk to execute and affix the seal to a certain, of the corporation to a certain agreement between the city and Hayho Rentals Limited. This relates to private property waste collection at 76 Cortland Terrace.
Questions or comments? Seeing none, all in favor? Any opposed? Carried. Next bylaw, please.
6th bylaw is a bylaw to authorize the mayor and clerk to execute and affix the seal of the corporation to a certain agreement between the city and His Majesty the King in Right of Ontario as represented by the Solicitor General. This relates to 2024 court security and prisoner transport program.
Questions or comments? Seeing none, all in favor? Any opposed? Carried. Next bylaw, please.
7th bylaw is a bylaw to authorize the mayor and clerk to execute and affix the seal of the corporation to a memorandum of understanding between the city of St. Thomas and Compass Early Learning and Care. This relates to infant and early years mental health project.
Questions or comments? Seeing none, all in favor? Any opposed? Carried. Next bylaw, please.
8th and final bylaw is a bylaw to authorize the mayor and clerk to execute and affix the seal of the corporation to a certain agreement between the city and His Majesty the King in Right of Ontario as represented by the Solicitor General. This relates to Next Generation 911 transfer payment agreement.
Questions or comments? Seeing none, all in favor? Any opposed? Carried. I rise to report the successful passing of 8 bylaws.
Good work. 8.
I have a motion by Counselor Peters, seconded by Counselor Gibson, that the report of council and committee of the whole on the 8 bylaws be received and adopted. The same be read a third time, engrossed, signed by the mayor and clerk, sealed and numbered.
Questions or comments? Seeing none, all those in favor? Any opposed? Carried.
No public notice or notices of motion for this evening. There is a need to move into closed session. I have a motion that this meeting be closed to deal with a matter of information explicitly supplied in confidence to the municipality by the province of Ontario and 2 personal matters about identifiable individuals. Moved by Counselor McCauley, seconded by Counselor Gibson.
As I usually share, we will be moving into closed session now for the next portion of our meeting. We will not be reopening to the public at the end of that meeting, except to adjourn our meeting for today. So thank you all for joining us here today, and we'll see you again next Monday. All those in favor? Any opposed? Carried. Thank you.
And Counselor Baldwin Sands, if